Hi guys, it's Kayla again. So I just kind of wanted to go over nursing school and how it's going because I just completed week 12 of 15 today. So this week was a short week. I have Thanksgiving tomorrow, and then Friday we don't have to go to school either. So yay, it's going by so fast and it's crazy. First thing that I want to mention, I have 2 weeks of clinical left. Not this week, but I have next week and the week after. So it's a pass or fail. Hasn't been going as well as I had hoped, but I'm sure it will get better. So we'll see. Another thing that I wanted to mention, I have a skills exam. Yay. And basically that's everything that we've learned in lab. We have to perform in front of our instructors and tell them why. So one of the things that they told us, we have to do a sterile technique, which could be a dressing change or urine catheter. We have to know our medications, what they do, what we're looking out for, interventions that we might incur. And then we have to know our lab values of why we would do something like that. And then IVs and IV piggybacks, plus injections. We gotta be mathematically correct. We have to make sure that our safety is all on board. So checking the name of the patient, their date of birth, their wristband, scanning all your medications, bed down, rails up, unless you're trying to do something that's bed up, rails down, well, on one side. And just trying to maintain safety, because that's one of the biggest things that our nursing staff is having issues with, is not being safe. We're not checking meds and the patient, and if they should be doing that. Do you have the right patient? Do you have the right medication? Do you have the right amount? And why are you giving it to them? So that's like super important, as it should be. So I have that, and that's either a pass or fail. We do get two errors that we can do, but we have to know that we did them. So say I went to go put on my gloves and my sterile technique was not sterile. My fingers accidentally, when I went to go put them on, dangled and touched a piece of paper on the table. It's no longer considered sterile, it is contaminated. Anything having it too low is contaminated. You need to make sure you put them up high, then when you take them off, you push from the center. Pretty self-explanatory, really. Except for when you take off the second one, you don't pull from the center, you go underneath and slide off and then kind of double bag them. Disposing of your sharps correctly, capping your capped pens, the ones that it like flips up, but you never recap a sharp after it's been used. Just don't do it. It's not right. That's why you have the sharp box. Yay. I gotta know like the acromion process and how once you find it, so mine is right here, I go 2 finger widths below and it's right here. Yay. So that's when I go to do my IMs or my flu shots. I gotta know what size needles I need, how big, how, gauge wise, how much can it hold. Insulin ones are like their own special ones. They usually have an orange tip on them, and they come in units, not milliliters. So, and then where do you put that? You put that in fatty tissues. And then I have to know like blood thinners. Where are you gonna put blood thinners? 2 inches around the umbilicus. Again, pretty normal things that we have to know. I think that's pretty much it for my skills exam. I could be wrong. We all have different scenarios that we're all going to have to do. I don't know mine until 15 minutes before I have to perform it. Yay. I'm scared. So anyways, quizzes. I told you guys last time, I failed a quiz. I got a 69 on it. Not the best, not the worst. You need an average of a 75 to pass this course. So my quizzes, I wanted to have at least, 80 or above. And so far it's not going all that great because the questions are not yes or no. It's what is the best. They all apply, but what one is the absolute best one that you could do? So my first quiz, I got an 80. Then I got a 69, got an 80 again, and then I got a 78. So my average right now is 76.75 for exams. My other quizzes, the ones that are only worth 5%, not my 65% exams, those ones I have an 89 average, so much higher. I have to write a paper that's worth 5% of my grade. And then my final exam, which is separate from my skills exam, is 25% of my thing, which is 100 questions. They're all 1 point each. And really, in order for me to pass, I need to have like a 68 on that in order to maintain everything, which means I have to get an 80 for my last 2 exams, a 68 for my final exam, do perfect on my paper in order to get the 5 points. And then all of my quizzes average need to be at least 80. So that's what I'm looking at. I'm really hoping that I get over an 80 for my final exam. I know it's like lowballing it, but when you're in nursing school, you just can't count on things, even though you know the information. Just some of the questions you're not prepared for, and I don't know what to say, you know? But it's going by so fast. I can't believe it has been 12 weeks now. So it's crazy. It is. It's really nuts. I'd love to talk to you guys more. I'd love to bring you on like a journey of my clinical days, if that was even a possibility. Or bring you to like my lectures and kind of show you, be like, hey, this is what I'm learning. Isn't this awesome? You know? And I guess I kind of want to do more videos like this, like more updates of how it's going, how I'm doing. I'm sure some of you guys are probably interested in that. Probably not. I don't know. So next week, which is my next full week, I want to try to do another video. I had been doing them right on my phone, but they keep disappearing and not uploading to YouTube. I literally made this video 6 times, I think. I even tried it yesterday and it just didn't work. And I tried it this morning and it didn't work again. So I'm going to start doing it from my laptop, I think. And hopefully that works out. So I want to do that. I want to do a video right after my skills exam and see if I pass or not. I do have 2 other tries if I don't pass to get it right the next time. But they cannot be done on the same day. So, but I have to wait until, well, I can't really talk too much about it while people are still testing it. So it'd have to be like the week after, I think. And then I want to do a video about the whole semester once I'm finished, what I thought about it, what was some areas I could have improved on, how am I going to improve things going forward so that next semester I do even better, and what I took away from it. So like right now, geriatric care is where I'm doing my clinicals. I know it's not my baby, but it's been so great. Like I've loved it. And I get really sad if I know my patients or my residents aren't doing as well as they had been. Or I get super happy when they're getting like even better and they're getting ready to leave the facility because they're only on skilled unit. It's great. It's a great feeling to know that when I am helping somebody, they look at me and say, you really like your job, don't you? And it's like, yeah, I do. I like to help people. I don't think I've ever been that way, but I'm learning to be that way. I don't think anybody's just born naturally to help somebody. They have to learn it and kind of adjust on where they should be. If that even makes any sense at all. I don't know. So anyways, guys, that's my update. We've talked about pharmacology, and that quiz went decently. So yeah, if you guys have any questions and you're going to be going to nursing school and you want to know how I stayed afloat somehow, or what I wish I had known, what I wish I had done, or any kind of questions really regarding nursing school, if you've already been there and you know, hey, this could help me out, yeah, please feel free to share. So anyways, guys, thanks for watching. Bye. Keep on nursing.